Welcome to the Outcomes Health Connections CCV Field Practitioners Training Program. This presentation will cover Course 2, Module 5, Diagnostic Testing Procedures. Today, I will demonstrate how to correctly use the Home Access FIT-CHEK Stool Sample Collection Kit. This fecal immunochemical test is used to screen for colorectal cancer. Your role in the collection process of this test will be to review the contents of the kit with the patient and to educate them on how to correctly collect their own stool sample. The FIT test is similar to a fecal occult blood test, except that the FIT is a newer test that doesn't require patients to follow a restricted diet before taking the test. The FIT test is more specific to finding blood coming from the lower GI tract than the FOBT. Many patients find the collection methods of the FIT easier than those of the FOBT. Fecal occult blood tests such as the FIT or the FOBT are usually recommended at regular intervals to screen for colon cancer in people who are over the age of 50 years. People at high risk for colon cancer because of family history or polyps may begin testing earlier, as determined by a physician. Be sure to inform the patient not to do the stool test during the menstrual period, or if having active bleeding from hemorrhoids. Now, let's begin by reviewing the contents and use of the FIT-CHEK Collection Kit. Your kit will contain instructions for use, 1 sample collection tube, a Ziploc biohazard specimen bag. This bag will be used for containment of the specimen during transport to the lab, a patient information label. You will fill out the label and place it on the biohazard specimen bag, an absorbent pad. This will be used to wrap around the specimen tube to absorb moisture that may occur during transport to the lab, a folded collection paper. This will be used to place inside the toilet to catch the stool sample, a return mailer. This envelope will be used for mailing the specimen to the lab. The last item is a 1-page colorectal cancer information flyer. You will give this flyer to the patient and explain the importance of colorectal cancer screening. Once you have reviewed the contents of the kit with the patient, you may begin instructing the patient or caregiver on the steps to take for the collection of the sample. If the patient does not want to have the test done, note their refusal on the lab page of the CCV assessment tool. If the patient agrees with having the FIT-CHEK test done, you are now ready to begin educating the patient about collection and submission of the sample. First, you may either ask the patient to fill out the patient information label, or you may fill out the label for the patient yourself. Ask the patient if they are going to complete the test that same day. If so, fill in the collection date on the label. The lab will not process the test without a collection date. If the patient states that they will not be able to perform the test that same day, remind them that they must fill in the collection date before sending the sample to the lab. Inform the patient that the gray wallet card at the bottom of the label sheet is not valid for this project. The test results will be sent directly to their primary care provider. The patient will need to follow up with their primary care provider to receive the FIT-CHEK test results. Confirm that the barcode on the patient info label matches the barcode on the sample collection tube. This number will be used to link the specimen to the correct patient. Once the patient information label is filled out, and the barcodes are confirmed, peel the completed label off the card, and stick it on the outside of the biohazard sample pouch. Instruct the patient that once they are ready to have a bowel movement, they will follow these steps to correctly collect their stool sample. Use the instruction sheet provided in the kit to demonstrate the steps to the patient. Step 1. Unfold the collection paper and place it between the seat and bowl of the toilet. If the paper falls into the water, that is acceptable as well. The sample will be suspended on the tissue paper on top of the water and can still be used for testing. The paper may even be unfolded and placed directly onto the surface of the water, instead of between the seat and bowl, if that works better for the patient. Step 2. Deposit the stool sample on top of the collection paper. Step 3. Open the green cap on the sample collection tube by twisting and lifting. Do not empty the liquid from the collection tube. Step 4. Scrape the surface of the stool sample with the sample probe, covering the grooved portion of the sample probe completely with stool sample. Step 5. Insert the sample probe with the sample back into the collection tube. Snap the green cap on tightly. Do not reopen the tube. Step 6. Flush the collection paper after the sample has been collected. The collection paper is biodegradable and will not harm septic systems. Step 7. Wrap the absorbent pad around the closed sample collection tube containing the stool sample. Step 8. Place the sample collection tube and pad into the biohazard specimen bag. Seal the bag securely. Step 9. Insert the biohazard specimen bag containing the sample into the return mailer envelope. Seal the return mailer envelope securely. Step 10. Place the sealed prepaid mailer inside any U.S. Postal Service mailbox the same day the sample is collected. It is important to remind the patient that the sample is perishable. It must be mailed the same day it is collected. Also, remind them that the patient info label must be completely filled out, including the collection date. In order for the sample to be accepted by the lab, inform the patient that their test results will be sent to their PCP. This process may take up to 2 weeks. They will need to follow up with their PCP for review of the results. You must then document the barcode, education and kit given to patient, and any other pertinent information regarding the FIT-CHEK test on the CCV assessment tool. Congratulations! You have completed the training session for FIT-CHEK collection. Thank you for your time and attention. We look forward to working with you on this project.